Sierra is a 19-year-old female. She was able to state her birthday and name appropriately. She was oriented to person, place, or time. She was well groomed and dressed appropriate for her age. She was cooperative. She was able to obey commands clearly. She, her posture was erect and relaxed throughout the whole interview, the whole assessment, and her speech was very clear and understandable. She used no assistive devices. She had no involuntary movements. When I got to her skin, when I inspected her skin, her skin was warm, intact, and dry. Capillary refill was instant. She had no skin tinting. Her brachial and radial pulses were strong and present bilaterally. Then I moved to her head and scalp, and she had no lesions on her scalp. She had no lesions on her scalp. Then her cranial nerves were intact. All her facial muscles worked perfectly fine. Her temporal arteries, they were strong and present bilaterally. Her maxillary and frontal sinuses, she had no pain or swelling in those areas, no tenderness. And then the cranial nerve 5, TMJ, she had no pain. It was intact. Then when I moved to her neck, her trachea was symmetrical. When I checked her lymph nodes, I checked her. She had no pain or swelling or anything like that present. Let's see. Her carotid arteries, they were strong and present bilaterally. No bruits present. And then after that, I moved to her eyes, and her eyes, Perla, they're reactive to light and accommodation. They were full by confrontation. Her conjunctiva were clear. Her sclera were white. She had no crusting in the eyes. And then I moved to her nose. She was able to smell the soap for the smell test. Her nares were patent. Mucosa was pink. It was moist. Then I moved to her ears. They were clear. They had no cerumen present. When I did the hearing test, she was able to hear in both ears bilaterally. Then I moved to the mouth and the neck area, throat area. I did the gag reflex, and she had a gag reflex. Gag reflex was present. Her mucosa was pink, and they were moist. There was no swelling or redness present. And then I moved to the posterior chest, and I inspected her chest. I then percussed her chest, and there was resonance noted, and breath sounds clear and even bilaterally. Then I moved to the front of the chest. I inspected the front of the chest, palpated it. There was no lesions, no masses, and I heard the breath sounds again bilaterally, clear and even. Then I moved to the heart sounds. All heart sounds were heard, and S1 and S2 were noted. I then moved to the abdomen, and there was no masses present. Umbilicus was midline. There was, the bowel sounds heard in all 4 quadrants. Percussion. I then percussed the abdomen, and tympany was heard in all 4 quadrants. I lightly palpated, then I deep palpated. There was no pain or tenderness noted. I then moved to the palpated the arteries, and they were strong and present bilaterally. I did range of motion on the lower extremities. There was full range of motion with resistance, and after that I did the I did the heel to shin, and I did the heel to shin, and there was no abnormalities. We then got up and did the upper extremities. It was full range of motion with resistance. I then did the scoliosis screen, which was no spinal. It was no deformities, no scoliosis present, and that's the end of the assessment.